Hello, I'm Lieutenant Commander Jesse Bandle. I will be presenting the findings of our research on behalf of my colleagues at the Veterans Affairs Hospital of Palo Alto and the Stanford Surgical Policy Improvement Research and Education Group. I'd like to thank SAGES for the opportunity to present our research. I'll begin with some brief background information about the Veterans Health Administration and our bariatric surgery program. To care for the over 9 million veterans enrolled, the VHA provides care across our nation with more than 1,200 health care facilities, including many large medical centers. Bariatric surgical care is offered at more than 20 regional facilities. The veteran patient population has a higher than average number of comorbid conditions, including higher than average rates of obesity, which distinguish veterans from the general patient population in the United States. Historically, there has been a significantly smaller proportion of female patients in the VA system, and this is reflected in the patients we typically see in the VA bariatric clinics, who are typically older than non-veteran bariatric patients and mostly male. Additionally, veteran patients have a significantly higher rate of mental health issues than the general population. With this background information in mind, we hypothesized that females comprise a growing proportion of veterans undergoing bariatric surgery within the Veterans Health Administration. In order to explore this hypothesis, we performed an IRB-approved retrospective review of national Veterans Health Administration data and identified patients who underwent bariatric procedures from fiscal year 2010 through 2019. We used Spearman rank correlations to analyze the proportion of female bariatric patients and stratify those results by procedure type. During the study period, close to 6,000 bariatric surgeries were performed. The majority of patients had sleeve gastrectomies. The average age of our population was 54 years, and the background demographics are displayed. As you can see, the overall number of bariatric procedures performed increased year to year during the study period. 365 bariatric procedures were performed in fiscal year 2010. That number more than doubled to 796 by fiscal year 2019. The orange portion of each bar represents male patients, and the blue portion is female. While surgeries for both male and female patients increased overall, the proportion of female bariatric patients steadily increased. The gray line at the top of the graph represents the increasing proportion of female patients during the study years, starting at 20% in 2010 and growing to 1/3 of our procedures by 2019. The trend towards increasing female proportion of bariatric patients was noted for both sleeve gastrectomy and gastric bypass, but was statistically significant in the sleeve gastrectomy group. The blue line illustrates that significant increase from 25% to 35% of total procedures during the 10 years examined. These findings are especially poignant in the setting of ongoing demographic changes in the current and future active duty military population. From the end of Vietnam conflict to 2017, the proportion of active duty female service members increased dramatically from less than 2% to nearly 20%. This trend is expected to continue in light of current focused efforts to recruit female service members. Changes in the demographic makeup of the active duty military will likely lead to similar changes in the future veteran population. In fact, as this graphic from the Veterans Population Projection Model demonstrates, while the overall number of veterans is projected to continue to decrease, females are expected to be the fastest and only growing demographic in the future VHA population. Our data support the conclusion that over the last 10 years, there has been an increasing proportion of females utilizing bariatric surgical services in the Veterans Health Administration. Several possible implications follow from this conclusion. VHA bariatric programs must anticipate greater need for gender-specific postoperative management. There may be increased need for fertility counseling, close monitoring of skeletal health, as well as focused attention to gender-specific cancer screening in the veteran bariatric population. Additionally, if veteran patients mirror the overall trends of female bariatric patients in the general population who are younger, have fewer comorbid conditions, but a higher rate of major depression than their male bariatric counterparts, we may need to focus our multidisciplinary preoperative evaluation process with these changes in mind. Improving the efficiency of our preoperative workup may serve to further increase the utilization of bariatric services in our patient population, with the goal of enhancing long-term outcomes for our veterans. Again, my thanks to SAGES for the opportunity to present our findings. If you have questions, please feel free to reach out to one of the study's authors. Thank you.